Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. When we come back, we will be discussing CustomView correction, a safe and effective procedure for treating nearsighted, farsighted, and astigmatic individuals with one of the Washington, D.C. area's leading ophthalmologists, Dr. Jacqueline Griffiths. Dr. Griffiths is board certified, had participated in the CRS USA LASIK trials to get the LASIK procedure approved by the FDA, and is recognized as one of this area's top ophthalmologists by Washingtonian Magazine. Welcome back to A New Me. We are here with one of this area's top ophthalmologists, Dr. Jacqueline Griffiths. Welcome, Dr. Griffiths.
Thanks for having me.
Oh, it's our pleasure. Welcome back. Let me begin by asking you, what exactly is CustomView laser vision correction?
Well, CustomView laser vision correction is an exciting technology. It's different from traditional laser vision correction in that each person's vision is individual to them. Everybody's eyes it's like a fingerprint. Their vision is like a fingerprint. And we've always known that two people who read the 20/20 line, for example, see the line in a different way. But we had no way of measuring it in the past. Now we can measure it and, in fact, treat those individual differences with CustomView laser vision correction and give them their personal best vision.
And what vision problems does it correct?
Well, we can correct nearsightedness, farsightedness, and astigmatism of most levels now.
And is it FDA approved?
Yes. In fact, we just got recent approval for higher levels of nearsightedness in recent months.
How accurate is this technology?
Well, the wavefront technology is 25 times more precise than traditional methods for measuring for glasses and contact lenses. It uses a waveprint map, and the waveprint map checks visual aberrations or insufficiencies by the way light behaves when it enters the eye.
And is there any discomfort that one would experience from this?
No. Checking waveprint maps, one just looks into a machine, so there's no puffs of air or any kind of pain involved with the technology.
Now, a few moments ago you mentioned personal best vision.
Yes.
Can you please tell us exactly what that is?
Well, because the wavefront technology is 25 times more precise in measuring one's what we call refractive error, which essentially is one's prescription for glasses, than any technology we've had to date to measure for glasses and contact lenses. And in addition to that, it measures one's unique aberrations in the entire optical system. And we can take that information, take it to the laser, and get that extra level of precision with the custom treatment. We can achieve now one's personal best vision.
And how does the CustomView procedure work?
As you can see from the screen, we first generate a wavefront map, which measures the acuity map in the upper left-hand corner and the higher order aberration, which makes you very unique, in the lower left-hand corner. And then finally all aberrations which occur in your entire optical system in the lower right-hand corner. From all the information that we've generated from the waveprint map, we can then formulate a treatment plan. And from that treatment plan, we make a floppy disk, which is taken to the laser machine and inserted, and that forms the basis for our custom treatment. And the VisicStar S4 excimer laser system, using a 3D infrared tracking system, uses a variable spot scanning laser, which you can see the spots of varying sizes and spheres, gently ablates tissue from your cornea and takes away all the unique aberrations in your eye and clears up any refractive errors that require glasses or contacts and all the blur, and that forms the basis for your customized treatment.
So it's a very technology-intensive treatment.
Yes, the wavefront system is very technology driven. However, the clinical exams is extremely important too. We do an enormous amount of tests in addition to the waveprint mapping. And those clinical tests have to be integrated into the waveprint system to generate the treatment plan for the custom laser treatment.
And how long does this treatment typically take?
The actual custom laser treatment oftentimes is less than a minute per eye. So while there's a lot of planning and the exam often takes an hour to an hour and a half, the actual treatment time is less than a minute per eye, and the patient is in and out of the laser room in less than 10 minutes.
So it's very quick, in other words.
It's quick for the patient. It's actually a long time in planning for the surgeon.
And what exactly does the CustomView procedure do for individuals?
Well, it gives the individual, again, the chance to have better than 20/20 vision in many cases. And oftentimes, they improve their night vision as well.
And what does better than 20/20 mean? I always was under the impression that 20/20 is as great as a vision as one can have, but you're saying it can do better than 20/20.
Well, statistically, we think the same thing. And statistically, 20/20 is the best vision that one can get. When one gets to 20/15, that's better than the average person can see. And our clinical data in the FDA trial showed that over 70% of patients who underwent CustomView treatments got to 20/16 vision or better.
That's very impressive.
That is very impressive.
Now, can these treatments improve night vision, for instance?
Yes, also in the FDA clinical trials, 4 times as many patients who had CustomView treatments experienced better night vision after having CustomView than they did with their glasses and contacts before. So that was very exciting and unexpected results.
And how long has this been available, Dr. Griffiths?
Well, the CustomView laser treatments were first approved approximately 2 to 3 years ago for certain refractive errors, such as low amounts of nearsightedness and astigmatism. And then over the years, we've gotten more and more approvals. So now we can do higher amounts of nearsightedness, farsightedness, astigmatism, and
So
such.
a lot more that you can offer in this area now.
Absolutely.
I wanted to also ask you if a person who may have undergone a traditional vision treatment in the past can have a CustomView procedure as an enhancement.
That's a very good question, and we get that often. Well, not often, because people don't need enhancements that much, but certainly they can. And we urge them to have CustomView as their enhancement procedure because we did not address the quote-unquote higher order aberrations, the unique qualities that make them different in the first procedure, and we now can address them with a CustomView treatment. So indeed, if they're a good candidate, we do urge them to have CustomView as their enhancement procedure.
And how can people get more information about CustomView?
Well, they can certainly visit my website at www.newviewlaser.com, or they can go to www.personalbestvision.com.
And lastly, we've only got a few moments left, and I wanted to ask you, Dr. Griffiths, if there's anything out there that our viewers should be careful of or cautious of when considering undergoing a CustomView treatment.
Well, first off, they should go to a qualified doctor and a qualified center that understands and knows how to assess someone properly for laser vision correction in general and CustomView in particular. There are various differences between the treatments of traditional and CustomView that a surgeon who's been doing it for a while would understand. Not every patient is a good candidate for CustomView. They may be a better candidate for traditional, believe it or not. And those differences would be known by a qualified surgeon. So because every patient is not a great candidate for CustomView, you shouldn't go into the center demanding CustomView. You should let your surgeon, who hopefully you trust, make that decision for you.
That's also always very important, and certainly the fact that the surgeon is board certified and is very familiar with the CustomView technology certainly would add to that.
That's exactly correct.
On that note, I want to thank you, Dr. Griffiths. It was a very informative interview today. Thank you again for being a guest today on A New Me.
Well, thanks for inviting me. I always enjoy coming.
We always enjoy having you on.